I'm Catherine Robbins. I'm a nursing student at Bellarmine, and I'm in the med room right now to demonstrate administering how to prepare medications for administration. Okay, so the first thing I'm going to do is hand hygiene, and then I'm going to check that I've got the correct patient mark and cubby. So it's George Jackson. George Jackson, birthday 12/24/1948, MR0841, MR0841. He's got 4 medications that are due. He's got a injection of hepatitis B vaccine. He has a furosemide 40 milligram oral tablet. He's got some human regular insulin, 100 units per milliliter due, and Protonox 40 milligrams oral tablet due. Okay? I'm going to start my first MAR now. Jackson's drawer. Okay, I'm going to start with my oral medications. Start with furosemide. Okay? Furosemide, 40 milligram tablet. The patient is George Jackson. The quantity is 1 tablet per oral daily, and the time to administer is now 0800. The packaging is intact, and the expiration date has not arrived. Okay. The second per oral medication is Protonox, 40 milligram oral tablet. The patient is George Jackson. The amount is 1 tablet per oral. Frequency is daily at 0800. Time is now. The packaging is intact and the expiration date is current. Okay, now I'm going to start on my injections. I'm going to do the insulin first. So I'm going to check his vitals to get a read on his blood glucose. His blood glucose reading is currently 323 milligrams. Doctor's meds. Okay, so the medication is regular insulin, 100 units per milliliter. The patient's name is George Jackson. Per the sliding scale, he's got 253 milligrams. So it's 323 milligrams, that's 8 units. The route is subcutaneous, and the time that it's due is now. So I'm going to allow it to dry while I prep my needle. This is a insulin needle. It's marked by a orange cap, so this needle does not need to be labeled. Okay, I'm going to pull back to 8 units. And then pull back to 8 units.
As long as they see that you're actually moving it.
Okay, there's a little bit of a bubble.
But then I touched it.
And then yours I had was dark and then I touched and I got light, so it's just
Okay.
cameramen are a little bit so we got
Okay, scoop the cap.
sorry.
And then I would need a second nurse to check.
Okay, so I see regular insulin, and it looks like you've drawn up 8 units. All right, for patient George Jackson, his blood glucose is 323 milligrams. And according to the sliding scale, he will be receiving 8 units. Great, which is what you've drawn up. Looks great.
And now I will prep the hepatitis vaccine. Okay, so the patient is George Jackson, and the medication is hepatitis B vaccine, 0.02 milligrams per milliliter. The quantity is 1 milliliter. The route is intermuscular. The frequency is once, and the time to do that is now.
The vitamin B12 injection is going to be 1 milliliter.
Okay.
Going to give an
I'm
IM.
gonna open up. He weighs around 220 pounds, so I'm going to use a 1 to 1.5 inch needle. When I'm prepping this, I'm going to make sure to keep these points of contact
So I'm going to go ahead and raise your bed a little
away
bit.
from contamination. I won't touch them. Okay. I'll pull back to 1 milliliter.
I'm going to be giving the injection.
Inject the air.
I'm going to palpate for her chromium process.
And then
I'm
pull
going
back
to give the injection.
a 1 milliliter.
In that site.
there, so I'm just going to pull back a little bit more so I can get rid of that bubble.
Let it clean inside, out.
Okay, there it goes. Scoop the
I
cap.
use the C-track method, so I'm going to go above this side.
Okay, since I have taken medication from this container to this one, I need to label it. So I've made a label already with his name, the medication, the dosage, the route, the frequency, and the time of 700. I've also put the date and his MR number. So I will place that right here so it doesn't cover the amount that's in the needle. Okay, now that I've done that, I'm ready for my second check. I'll start with my oral medications yet again. Okay, so the first one I've got is furosemide, 40 milligram tablet. The patient is George Jackson. The quantity is 1 tablet by mouth daily. The time to administer is now. Furosemide, 40 milligrams. Packaging is intact and expiration date is current. The next thing that I'm going to check is his Protonox. Protonox, 48 milligrams. Quantity is 1 tablet per mouth. The patient is George Jackson. Frequency is daily. And the time to administer is now.
Yeah, I like
The packaging is intact and the expiration date has not arrived. I have my insulin. Okay, it's human regular insulin. The dosage that I have pulled up is 8 units based on his vital signs reading at 323 milligrams. So if I go back, 323 milligrams would be 8 units. I have 8 units here. The schedule is every 4 hours. The time to administer is now. Then I have my hepatitis B vaccination. So the patient is George Jackson. The medication is hepatitis B, 0.02 milligrams per milliliter. The quantity is 1 milliliter, which I have here. The route is intermuscular. The frequency is once, and the time to administer is now. Okay, now that I've completed my second MAR, I can go to the patient's room to administer these medications and perform my third MAR. I'm just going to do one final check of the MAR to the cubby. So the cubby is George Jackson. George Jackson. Birthday 12/24/1948. MR number 0841. MR 0841.